Yeah, so I'm Timothy Craig. It's nice to be here with you. I'm at the Penn State University in Hershey, Pennsylvania. I've been there now almost 30 years. My focus has been rare diseases all along, with little steps into sleep and asthma. Right now, I focus mainly on hereditary angioedema. I've done just about all the trials for approval of the medications out there, and I've done a lot of work on guidelines. I did the first authored the first WAO guideline for hereditary angioedema. So that's kind of what I live and dream about right now. And it's really been an exciting field to be part of because we've made such a big difference in the for treatment of patients in this space. It's envious compared to many other rare diseases because of how much has been accomplished in this space. We're going down, we have modern technologies of gene therapy and CRISPR technology, as well as drugs that are really fantastic in the sense the majority of people are symptom free. And so I've been really excited to be part of this space and thank the patients who have entrusted us and the people who have joined research. And I look forward to what the future brings. It's hard to believe it can get it any better than it is already, but it will. So right now we have a lot of good therapies, very effective therapies. I think for the future, we're really looking at a reduction of burden mainly. So there's pills coming out. So some people prefer pills over injections. Now we have some therapies that are once a month, which are just approved. There's other therapies that are looking at every 3 or 6 months. There's some people who are excited about CRISPR technology and may only have one treatment for their whole life. So really what we're looking now is reducing the burden because I think the efficacy we have out there is pretty good. So can we get the same though, say on an injection once a month as you can with every other week or even an injection every 3 days that you can replace with an injection once a month? And then, we're looking at the further future, like I said, is maybe an injection with less frequent than even once a month. So Garadacimab is a really exciting drug. It inhibits factor 12A, which is the very top of the contact pathway. Factor 12A also has a lot to do with the coagulation pathway, the complement pathway, the fibrinolytic pathways. But we looked at the safety of that very carefully of, is there bleed and is there clotting and there's not. But it's very effective at decreasing the contact pathway. And the contact pathway, the beginning is factor 12A. The end is actually bradykinin, which is the mediator of the swelling and angioedema that people get who have hereditary angioedema. There was a series, a long series, right? With first level research, and then we went into the phase two of the trials, then phase three, and then phase three open label for a long time. There was also an open label people who were in phase two could go into. And so we've had a lot of data over these years of research. And what we found was the 200 milligram dose was the best. We actually evolved into now auto injectors as well. So a person can do an auto injector with delivering those 200 milligrams and have in just mainly seconds. The other thing too that's been very excited about it is that there's no citrate in this formulation, so skin tolerance is maximum. Injection site reactions are minimal. So that's an advance. Also, it was given with a loading dose, and that means that people have efficacy from almost day one, so which is really exciting because some of the medications out there now take up to 6 weeks to really get full effectiveness. So a person has to be kind of conscious that, it may not inhibit those reactions or attacks over the first month or so. But here, it looks like it's from the first dose. So I think most of those are very exciting because you can get the same efficacy at once a month as the therapies that are out there, which require injection at least every 2 weeks and some even more frequent than that. So when, I look at a study, there's two things that I really focus on. First is the suppression of attacks, and the suppression of attacks are greater than 85%, 87, somewhere around that we just know it's very good. The other thing is the majority of people were attack-free during the studies, which is really exciting. So in the past, there's been a good portion, but here now we have the vast majority of people who were on the medication had no attacks at all. And that's really what we want to achieve, right? That has to do with quality of life. It has to do with post-traumatic stress syndrome being less, inhibiting on a person living normalcy. So I think that's what patients look for. As a physician, that's what I kind of look at my target as being helping a patient get through their disease is to have no attacks. And, that has a lot to do with anxiety and the ability to a person, say, a young lady going out to, say, soccer tournaments with her colleagues who are also playing soccer. It has a lot to do with someone who's going to work and needs to fly in an airplane, go to Europe for a week. So that whole thing of attack-free is very, very important. What it means is that you'll have a new drug out there that has very good efficacy. We know the safety is great. We know the injection site reactions are minimal. It looks like you can start a drug on once-a-month therapy, anticipate that it's going to work very rapidly, so you don't have to educate them about, well, the first month or so, you may still have attacks. And you can ensure that the majority of attacks are going to be reduced, and the majority of people actually will be attack-free. So I think that's the excitement part of having a new medication. There are other drugs that are almost equal coming out in the future, but it's kind of nice that, this is the first one that's monthly, and I think in the future we're going to find drugs that maybe be used less frequently, but this is a great start, and I'm really looking forward to it. So, there's a few ways you can find out about this information. There will be a link at the end of this program, which you can go to see, the safety and the efficacy of Garadacimab. Again, it's an auto-injector, and there'll be some information about how to use an auto-injector on that site. And, I'm always available if you ever having difficult questions or you just need to converse about the efficacy of this drug or other drugs, and never hesitate to call or reach out to me. It's pretty easy. It's tcraig@psu.edu.